Minister, Commissioner, ladies and gentlemen, welcome to eHealth Week 2015.
This eHealth Week really gets a wide range of stakeholders out here, good numbers of people from a diversity of member states, as well as transatlantic, particularly from the US. And then I think there's been a great exhibition that I've really enjoyed going and seeing some of the main corporations.
So with, I think, more than 1,000 attendees this week here in Riga, I think we're all having very lively discussions, and I'm confident that we will all return home with new insights around the opportunities and the challenges of creating patient-centric, digitalized, connected healthcare systems.
From my point of view, it's a very good opportunity to deal with different CIOs from top-ranked hospitals into the Amsterdam scoring.
I like it a lot. It's a good place to come and network and get the impressions of what's going on, meet with the vendors and the industry. As a researcher, it's a very useful thing to be here to see what's going on and what they're thinking on the vendor side.
Well, it's the first time I've been to such an event like eHealth. It's a new world for me, but I'm really willing, of course, to get the most out of it. So I try to talk to as many people as I can to see what they are doing in our world in health technology, eHealth, mHealth. And I think it's a really exciting world for me, sure. And I think the possibilities are almost limitless.
The eHealth Week here in Riga is a great opportunity to get some really new ideas, inspiration, especially this year that the whole issue of eHealth gets a completely new momentum also on the European level.
We have the opportunity to meet with the various delegations from the various ministries of health, and that's always very interesting for a company like Cerner to get ahead of the game insofar as seeing what the strategies and discussions are.
This event, being on a European level, is important because you can share and meet people from other countries who are all working on eHealth. And there are a lot of sessions and great opportunities to learn from others and meet them.
I think it's always very important to exchange experience not only on the national level but also on the international level with our European colleagues.
It was exciting 3 days here in Riga, and we got many informations from the EU political side on the topic of eHealth and its further developments, and we got interesting talks with innovative companies from all over the continent.
We've been discussing a lot about how to integrate information coming from patient, socially generated from wearable devices, to be then put into the flow of patient records, because this is still a big challenge.
I want to just to get a glimpse of best practices on health IT around Europe. Also, I have some concrete aspects to see, like mHealth or analytics or closed-loop medication, but also to greet all friends and make some new contacts.
Let's meet next year in Amsterdam with the eHealth Week, where we will show how the Netherlands, which is a digital society, copes with all the questions we have in developing the eHealth, and want to show something about our beautiful country, about Amsterdam, but especially want to meet with you. Come to Amsterdam next year.